Hello everyone. Since we started talking about the tefillin, then we might go over a few small halachot that are tefillin related. One of the most common situations in a hospital setting is that a patient calls and asks for some help with the tefillin, but he has an IV connected. And he asks, is it possible for me to put on tefillin? Am I making a bracha? And how do I exactly manage with the tefillin and the straps, the retzuot of the tefillin? So, as a rule of thumb, the Shulchan Aruch tells us as follows. The tefillin themselves need to be directly on the skin, and there cannot be a separation between the tefillin and the skin. However, this applies only when we're talking about the arm, meaning if there's an IV right here, and when a patient would like to put his tefillin, and there's going to be a separation between the skin and the tefillin, this is where he is allowed to put on tefillin, but he is not allowed to make a bracha. He's not allowed to make a blessing. However, if the IV is in a different place, in his hand or somewhere under the arm, then it is okay for him to put the tefillin right here. He makes a bracha, and the straps themselves, it's okay if there is going to be a separation between the straps and the skin, to such an extent that if it's impossible or too hard for him to make all the wraps around his hand, it's okay if he just puts the tefillin here with the bracha, makes the shin over here on the arm, and the rest, it's enough that the strap will be just directly placed on his finger without rolling it around his hand. And all of this with the bracha.